Hi everybody, my name is Dr. Lydia. I am a shelter veterinarian here at Plus Humane Society. And if you're new to these videos, this is a debriefing video from our buyout program intake this week. We had 23 horses come in who I did exams on over the past 2 days. I'm missing Dr. Gina, our wonderful, wonderful other veterinarian. I'm so proud of her. She is going on to do wonderful things. So I'm the only vet here doing this today. And I'm going to go through every single horse, read our exam notes, and try to, with as little crying as possible, tell you outcomes. And then the ones that we still have here at Horse Plus, try to give you a little idea of where we are today and where we're going from here. I have 23 horses to go through. So I will do my best to be thorough and understandable and not take forever. So unfortunately, these guys don't have names yet. So our wonderful supporters name these horses. It seems really impersonal that we call them numbers. I promise they all get names, even the ones that we have to say goodbye to in a really brief period of time. But I'm going to give you B numbers today. And I always try to give the caveat. I'm not always quite as thorough as I could be. I promise anything that is painful got pain medication. So if you hear me talk about something that was very painful, and I don't say, and we give pain medication, they all get pain medication if they need it. So let's get started. I'm not going to split these into two different groups. I'm just going to go through in order, but we did spread these over 2 days. So our first number is B25-149, a 2-year-old saddlebred stallion. He was unfortunately down in the first trailer that arrived. So if you watched our intake video, he was really, really sad and stuck and had been stepped on a lot of times. He was kind of a white color, but he had a lot of wounds and was very dirty. So he was down in the trailer, and we did have to pull him off to an area where he could safely get up. He was able to get up and get off the trailer. His initial heart rate was 76. Upper end of normal for horses is in the 30s, and an elevated heart rate is a really good indication of pain. This guy was also very dehydrated. He did have almost no gastrointestinal sounds, so that is an indication that the body is sending its resources elsewhere. If the GI tract isn't working, it's not a good sign in an herbivore. He had copious quantities of nasal discharge, so lots of snot. He was actively coughing and sneezing. He had really bad conjunctivitis. His capillary retime was prolonged, so that's an indicator of hydration status and the circulatory system. It's really easy. You can push on their gums. In human medicine, they do a fingernail to your fingernail. So his capillary refill time was prolonged, meaning he was dehydrated. He had very pale mucous membranes. He had papillomaviruses on his nose, which can be common and benign in young horses, but that's an indicator that the immune system hasn't been working properly for a long time. He had a very bad club hoof on his left hind leg. He had deep suspensory limb desmitis on his right hind leg. He was almost a 6 out of 6 lame on the left hind leg. And he had severe contracture of the extender tendons of that leg. And unfortunately, we don't have the result of his radiograph. So on intake, Dr. Marina, who's an incredibly wonderful friend and colleague, she did the diagnostics. So she wasn't able to be here with us today. We can get you more information, but the injuries to that leg were catastrophic and inoperable and irreversible, and this horse continued to be painful despite pain medication that was given immediately, and he was given the last act of kindness. Normally I say it gets easier over time, but this was an incredibly heartbreaking group of horses, so stick with me. B25-150 was a 20-year-old saddlebred mare. She was a body condition score of 2 out of 9. She was extremely emaciated. She had absent gastrointestinal sounds. So the term for your guts aren't moving is ileus in horses. Ileus is usually secondary to some other disease process. It can be dehydration, it can be starvation, it could be major multisystemic organ failure. In this mare's case, we don't know why her gastrointestinal tract wasn't working, but we heard absolutely no gut sounds. She was actively straining to defecate, holding her tail up and pressing with her abdomen, and no feces were coming out. She had a large wound over her withers that were very painful on palpation, and she had lost hair down the sides of her body from scald because that wound was creating so much discharge that it was burning the sides of her body. She did have mammary development, so we suspect she had recently weaned a foal, but we did not suspect her to be pregnant. And unfortunately, when we took radiographs, Dr. Marina found a deep gas tract that was associated with the wound on the withers, as well as, I'll explain what this means, dystrophic mineralization within the nuchal ligament. So what that means is the big soft tissue structure that runs along a horse's head and neck and over its withers and down its back that moves and stretches every time they move their body had so much chronic inflammation and infection that the body created mineralized areas which essentially look like little bone chips within that ligament. It can be incidental in some horses, but in this mare's case, she was very painful at that area. And the way the wound looked and the way the x-rays looked indicated a very deep tracts of infection. And in addition to that, she had bad nasal discharge. So she had respiratory disease, a badly infected wound, painful areas of her back, and major gastrointestinal disease. And I don't want to justify too many things, but as you hear us go through these horses, it's easy to hear one thing, and I actually do this as a clinician. You see one wound, you see one problem, and you go, oh, I can fix that. Just the wound by itself. Maybe if we use laser therapy, maybe if we, do a regional perfusion of antibiotics, it's easy to look at one thing and go, just the nasal discharge or, just heart disease. But unfortunately, in a lot of these horses, they have so many things going on and their bodies are fighting so many things that it's not fair to them to push to keep going. And in this mare's case, her gastrointestinal disease, I actually was more concerned about than this really severe wither problem. And she was given the last act of kindness. These horses were in really horrific shape. And if I were an observer of this organization, I would want to know those details. That horse didn't look so terrible from the outside. Tell me why you made the decisions that you did. So B25-151 is a 7-year-old paint gelding. He's very cute. He looks like a little wild, chunky something. He appeared to have very, very recently been gelded. He had an open draining wound associated with an empty scrotum that had mucopurulent discharge, which is just pus coming from that. He has a pretty significant puncture wound to his left front leg that has kind of like bubbly gas coming out of it. He has a laceration of his right nostril. He came in with hives, which kind of came and went and seemed to resolve mostly by the time we stopped looking at him. He did have a cloudy appearance to his left eye. The wound was on the cranial aspect of his radius on his left front leg. It's about 4 by 4 centimeters and roughly round. And when I probed it, I could probe at least an inch in several directions. But when we took radiographs, there were no deep gas tracts and there were no indications of a fracture or that the bone was infected. I took samples from, he also had nasal discharge. So I took samples from his nose, his scrotum, and the wound on his left front. He got his wound clipped and cleaned and wound ointment applied. He was started on antibiotics, and once we have the results from his samples back, we'll evaluate his treatment plan further. So I'm hopeful that we can get him better. He does have strong indication of infection on his blood work, but his neutrophils, which are kind of the first responder immune cells, were much higher than others. So it gives me hope that maybe his infection is recent enough that our antibiotics can target it and get him better. B25-152 is a 16-year-old paint mare. She looks like a baby. She has a little pink baby face, and I kept looking at her and thinking she was like 2 years old, and I looked at her teeth and was very surprised. Her body condition score is only a 2 out of 9. We had a lot of just emaciated horses on this load. 1 out of 9 is like, you are so skeletal that you're almost at death's door, about to pass from emaciation. This mare is brown and white. She was very resistant to allow us to examine her mouth, but on initial exam, there weren't any major abnormalities. So she is down to have dental radiographs and a more thorough dental exam. But her gastrointestinal sounds were normal. She did have some nasal discharge, but her lung sounds were normal. Her pulse and respiratory rate were normal. She did have some enlarged and scarred submandibular lymph nodes. So lymph nodes are very nonspecific. They can show us inflammation or infection. We always pay attention to these ones, especially because there's a bacterial disease horses get called strangles, which is Streptococcus equi. And so I always specifically really check these horses coming in. Hers felt like scar tissue to me more than active infection. She had very overgrown, neglected hooves and a superficial wound over her left hip. And she received some core vaccinations and a dewormer, and she has turned out to decompress. Oh boy. I wish we could show you guys some of the imaging, although I think our media team put some of that into the episode. So for some of these, when we talk about radiographs, we had some truly remarkably bad images from this buyout group that I think are sad but really good learning opportunities. B25-153 is a 30-year-old Haflinger mare. She's at least 30. I don't feel confident aging horses over 30 years of age. She has almost no teeth. She is a body condition score of 2 out of 9. Her resting heart rate was 48. This mare barely moved. So to me, a resting heart rate, there's a range. So resting heart rate of 48 was definitely elevated, even though normal is kind of upper 30s. For a very geriatric animal that isn't even moving a few steps, that's pretty high. She was observed ignoring food and or quitting, which is not, quitting is spelled Q-U-I-D-D-I-N-G. If you've ever seen a horse kind of wad up food in its cheeks and drop balls of ingesta that aren't really chewed, that's an indication that you have dental disease. So when this mare did try to eat something, even small, soft horse treats, they would end up wedged in her cheeks. So before we examined her, we knew that we probably had a dental problem. She had bilateral cataracts. She was visual, but reduced vision on both sides. She had very unkept, poor quality hair and very overgrown hooves. Her right hock was swollen and warm, and she was lame on that leg. And she had pain on palpation of her back. And when we took radiographs, we found a lot of osteoarthritis and severe pathology in her mouth. She had multiple fractured teeth. She had some missing teeth. She had a severe hook wave mouth, and she had a lot of furcations. A furcation is just, if you picture a tooth with a bunch of roots, there's a little U shape at the top of the tooth that's supposed to be way up in the gums. And if the tooth is loose enough that it's come all the way down that you can see the U coming under the gums, that's a severely compromised tooth. And in equine dentistry, that's always an indication that that tooth needs to be pulled. And so that was almost all of her teeth. And she was so thin. And she was given the last act of kindness. B25-154 was a 25-year-old quarter horse mare. She also was extremely thin and emaciated. She had some brands. She had a 15 on her shoulder, which someone on our staff said is the year of birth, but this mare was definitely not born in 2015. She had another brand on her left hip that was a D at the top, 2 zeros in the middle, and a W at the bottom. If you're watching this and you know what that brand means, we'd love more information on these guys. If there's anything we can find out. She was bay. She had a grade 5 out of 6 heart murmur. You've probably heard me say this before if you watch videos. In private practice, I had never heard even one horse with a heart murmur. I don't think I heard a single one in veterinary school. I worked as a large animal technician before that. I had never heard a horse with a heart murmur. We get them almost every intake day at Horse Plus, and I'm really thankful. We had our senior veterinary student, Dr. Alex, here with us for intake, and I'm really thankful that she got to listen to. 6 out of 6 is the most severe it can get. 6 out of 6 murmur you can feel from the outside of the body without a stethoscope, so a 5 out of 6 is pretty severe. She had very bad diarrhea. She had increased peristalsis, which is the name for the gurgles in the small intestine. So that indicates that the GI tract is moving food through too quickly. She had very, very worn and missing teeth. She had bilateral cataracts, overgrown and neglected hooves. She was very painful on palpation of her neck and back, especially her cervical spine and her withers. And this is so hard to even talk about. So a lot of the older mares that I see that are so thin, this mare's rectum was recessed almost 8 inches. So it's when they get so thin, the anus kind of gets sucked further back in the body. So normally in a mare, you have the rectal opening and then you have external vulva. And in this mare's case, she was so recessed that her external vulva wasn't even just horizontal, it was tilted this way. So when these old ladies defecate, they defecate and the fecal matter lands in the external vulva. And this results not in just even in mechanical irritation, but chronic infection. And those infections spread to the urinary tract. They can spread through the ureters to the kidneys, and they can cause just chronic severe burning and discomfort. These poor ladies. She was given the last act of kindness. B25 155. I aged her at 16. But this mare was a branded standard bred, and aging based on teeth is inaccurate. So this mare's brand read 6FB09 or maybe GFB09. We weren't able to find her. So if anyone's good at internet sleuthing, we have a good picture of that. But she was a branded standard bred. Oh, someone did find her. Her name was Artistic Dreams, but we didn't record how old she actually was. So if you want to see how inaccurate veterinary aging can be, you can look her up. Usually we're at least within the correct ballpark. Her resting heart rate was 52, and she had heartbreakingly fractured carpi bilaterally. So the carpus is kind of the knee in a horse in the front joint. And just standing and looking at her, my 5-year-old could tell you that her knees weren't normal. Her legs were malformed severely. And when we took radiographs, she had severe osteoarthritis with proliferative bone and marked secondary severe soft tissue thickening. So synovitis and effusion are both terms that mean she didn't just have irregular, painful bone grinding on bone. She had the cartilage that is supposed to soften and cushion that bone was worn through and had inflammation. And then all of the soft tissue structures, the tendons and the ligaments and the subcuticular space was all inflamed and painful. It was horrifically bad. And also looked to be years old. She looked like she had been used as a broodmare after she had been injured. And again, in case you missed it at the beginning, any of these horses that are painful got intravenous pain medication. So this mare got pain medication right away. She was given the last act of kindness. It's always really difficult when you see a horse that looks painful because you don't ever, ever, ever want to euthanize an animal that has a chance of saving them. And sometimes, like this morning, we looked at a horse that was super crippled lame on his left hind, but then we found an abscess tract, and that is a very fixable problem. So as a clinician, you're always balancing, I need the evidence to guide the action steps, but I don't ever want to be unfair to an animal. So we give pain medication and we do the best job we can to be fast and fair to these animals. B25 156 was a 25-year-old bay quarter horse, also emaciated, body condition score 2 out of 9. She had bilateral cataracts. She had very bad conjunctivitis and scleral injection. That means her eyes were really, really red and irritated. And she had some eye discharge and some nasal discharge. Her resting heart rate was 56. Again, upper end of normal is in the 30s. So heart rate is one of our best indicators of pain somewhere. It's not always there. Sometimes we see really stoic horses with a normal heart rate and obvious pain. In this mare's case, she failed proprioceptive placing. So she was almost falling with her back hind legs. Proprioception means, does your brain know where your legs are? So you can have the signals from your legs to your brain or your brain to your legs. Brain to legs means, I want to walk, let's take a step. But legs to brain means I know where I am. And in this mare's case, the legs to brain signal was abnormal. So that is an indication of neurologic disease. It means somewhere in her central nervous system, she had an abnormality. She also had severe pain on a palpation of her back and especially her right pelvis. And the way she was walking, Dr. Marina and I both looked at her and discussed possibilities for diagnostics, but it appeared to be isolated to her pelvis itself, which is very hard to get radiographs of. But due to her age, poor prognosis for neurologic disease, and the severity of her discomfort, she was given the last act of kindness. Are you guys depressed yet? This job is so difficult. And a lot of people like to criticize this organization for our euthanasia rates. We hate it. We want every single horse that we get to have a fair and loving and forever home. But so many of these guys, they should have been let go years ago, and their owners didn't advocate for them. B25 157 was at least 25 years old. He was a little miniature pony, and he was so sweet and so compliant. He was also pretty thin, not quite as thin as the others. He had a cardiac arrhythmia. So a murmur is, instead of lub dub, I hear some other sound. Usually it's like lub dub. An arrhythmia means instead of a regular beat, we have something else going on, whether it's fast and then slow or something else extra. So he had an arrhythmia, but not a murmur. He had an elevated respiratory rate, so he was breathing more quickly than normal. His mandible was locked, so one really easy, quick way to gently check and see if there's something major going on with the occlusal surface is to just kind of ask them to move their jaw back and forth. And so I never push this. I'm always really careful. He wasn't able to move his mandible, and that indicates that there was a problem in the mouth. This poor little guy had digital pulses, strong digital pulses in both front and back feet. A digital pulse just means this is your digit, right, the feet, and you shouldn't be able to put your finger on the back and feel a strong bounding pulse. If you've ever slammed your finger in a car door and you feel that like pulsing beat in an inflamed thumb, that's essentially what's happening in a hoof. What's hard with horses is, your thumb can swell up, but a hoof is a rigid structure. So when you have severe inflammation in the hoof, it's not just pain, it's that pressure and pain. And Dr. Marina took foot radiographs, and he didn't even have a coffin bone anymore. He had been foundering for so long and so severely that the coffin bone and the wall of the hoof are supposed to be parallel to one another. And his coffin bones were rotated, not even just straight down, almost past the point of going through the bottom of the hoof. And the only reason his bone didn't go through the bottom of the hoof is that he had been neglected and his feet were grown so long that there was a thicker sole there. But such a sweet little thing. I mean, he stood there and did everything possible to comply with what we asked him to do. And he was given the last act of kindness. And also really good pain meds. Again, I keep leaving that out. I don't want to spend too much time, but actually, I want to point this out on this little guy. Very often with active founder cases, which founder and laminitis are synonymous with one another, it's like layman's term, you see rings on the outside of the hoof and they have like an overgrown, we call it slipper toe. This pony had none of those signs. You looked at his feet from the outside, and if you didn't take the time to feel and know exactly what you were feeling for, you could have looked at his feet and gone, he has great feet. He looks totally fine. Like, we actually looked at him from the beginning and I thought maybe he has back pain because he was kind of hunched over. But it was his feet, and he just, all of the damage was inside the hoof and he didn't show it on the outside. So diagnostics are so important. If your veterinarian comes and they're not able to do imaging, they cannot give you an idea of prognosis. Because if I just looked at this guy from the outside, I would have gone, It looks like an acute founder from the outside. You can treat them when it's an acute phase, when they don't have that severe sinking and rotation. And this guy was so far gone, it would have been incredibly unfair to ask that of him. So our next B number is B25158. He was this beautiful, tall, super thin, but very majestic saddlebred gelding. He was 15. He was bay with a small start. Just one of the most dignified gentlemen I have ever met. He was a very good boy. His resting heart rate was elevated significantly. He had a big wound over his tail head that was pretty superficial. He had scars over both his left and right hocks, and he was very, very lame on his right hind leg. So just giving you a visual, his left hock was about this big, and his right hock was about this big. So it was huge, and he kind of dragged it and knuckled over on that leg. And we took radiographs of his hock, and again, Dr. Marina took these radiographs, but there was evidence of an old fracture with severe arthritis, and the same thing as I described with the other mare. We didn't just have a bony component where bones are grinding on bones. We had evidence in all of the soft tissue structures, the joint capsule itself, the articular cartilage, the tendons and ligaments surrounding that, and the whole joint was affected. So he was very, very painful. Such a good boy. He tried so hard. He let me palpate the whole joint, and you could just tell. I mean, he very much was like, please do not hurt me, but he was so compliant. After pain medication, his heart rate came down to about 40, but he stayed really uncomfortable and stood without his weight on that leg, and he was given the last act of kindness. B25159 was only 3 years old. She was a little standardbred mare. She was bay. She was very thin. Her body condition score was a 3 out of 9. Her resting heart rate was 66, very elevated. On her right hind leg, she had scars that circled her whole leg multiple times. So my best guess is that this little mare got her leg caught in wire or rope or something. It wasn't, sometimes we have just like a snare that's one. So she had multiple areas, and then she had about a 5-inch section of excess granulation tissue, which is called proud flesh. Removing proud flesh it's not an easy surgery, but it's very doable. But in this mare's case, the location of it was right on the front of a hind leg, and all of the surrounding area, probably like 12 to 15 inches surrounding it, was rock hard and lumpy and thickened. And when we took radiographs, we found a severe bony proliferation associated with it. So if you picture, this would have been the surface of the normal leg. This is about what we saw from the outside, and this roughened irregular bone was like a centimeter below the surface on the whole thing. So we couldn't have reduced that because we would have cut into infected bone. What's really heartbreaking about these cases, and this wasn't the only case like this that we saw, if this mare had had appropriate veterinary care immediately following, her chances of getting a bone infection go way down if she just had appropriate, timely care, and she just didn't get that. And by the time we got to her, was nothing that we could do with that leg. And I hope that if you watch this video, you pair it with watching the intake video so you can actually see these wounds, because words don't do justice to them. She was a very sweet girl, and she got pain medication, and she was let go with kindness. B25160 is, I love this boy. He's about 25 years old. He's completely blind, and he's a Belgian gelding. He's very thin. His body condition score is about a 2 out of 9. His resting heart rate was 45, but with some anti-inflammatory medication, it came down to normal pretty quickly. So it's not just how high your heart rate is, it's how does your body respond when you're given pain medication. He had normal gut sounds. He does have some nasal discharge and some excess lacrimation. He has severe hoof neglect, really pancakey feet, but he has shoes on. His feet are like inches and inches overgrown. So I don't know why anybody would put shoes on that horse without trimming them. But he had enough teeth that I think I can improve them to the extent that hopefully we can get weight back on him. And even though he's completely blind, his eyes are not painful. And he doesn't have entropion. So if you guys have watched Horse Plus, we take a lot of eyeballs out. If an eye is blind and not painful, you can leave it in. If it's blind and painful, you take it out. Over time, when horses go blind, sometimes the eye shrinks. It's called microphthalmia, micro, little, ophtho, eye. And so one of his eyes is starting to shrink, but that shrinking happens really gradually over time. So if this horse was a 4-year-old, I would definitely remove both of his eyes. As a 25-year-old, his eyes probably are not going to shrink appreciably enough over the next 5 years that he's going to experience entropion. So I don't even think he's going to need to have surgery to have his eyes removed. He is down to have his teeth fixed. He had some electrolyte abnormalities on his blood work and one slightly elevated liver value, which reminds me, we have a wonderful company that donates products to us. They just sent us a product that's a liver support supplement. So I'm so thankful when companies donate stuff. We don't have horses with liver disease all the time, but this guy's a perfect candidate for that supplement. He's also pretty anemic. So usually just basic supportive care and some groceries can help with that. So he is going to see the farrier tomorrow. And then after that, he's going to be turned out to decompress. Oh boy. B25161 was a 20-year-old mare. We guessed that she was a standard bred, but she wasn't branded. So that breed is a guess. She was also very thin, body condition score below ideal. Her resting respiratory rate was over 80. So normally respiratory rates in horses are like 16, 18, maybe 20. 80 is like she was actively panting. Her resting heart rate was 60. It did not respond to pain medication. So her heart rate stayed in the 60s. Her respiratory rate stayed in the 80s, even in air conditioning, even with pain medication, even with some sedation. Both of those things stayed elevated. She had increased respiratory rate and effort, increased respiratory noise. So when you listen to her lungs, both inhale and exhale, it sounded kind of like, normally you hear nothing. If you hear any sounds in a horse's lungs, it's not normal. To the extent that when we do a lung exam in a horse, it's called a rebreathing exam. They literally put a bag over both their nostrils. So they're rebreathing the same air. And it stresses out the lungs and it makes them breathe with more effort. So these were severely abnormal lungs. She was blind in both eyes, but seemed to be really well adjusted to the blindness. So that was not a major issue for us. But she did have nasal discharge. This is another example of why it's incredible to have access to a radiologist. So Dr. Marina isn't just a veterinarian. She has an additional specialty in diagnostic imaging. So she did an ultrasound of this mare's lungs and was able to determine that not only was the problem disseminated, but was very deep in the lungs. So there's a lot of things that can be superficial that we can try to treat. But in this mare's case, it was both lungs, all of her lungs, and she truly was in distress. I mean, she was actively panting, not responding to medications. And we stopped and discussed it. I really wanted to try a high-dose steroid trial, and Nicole was like, I'm really afraid that we're going to find her deceased in the morning. It really was that bad. And Dr. Marina's input was, any of these differentials that we think we might have had a good chance of treating, we've ruled out by confirming how deep and disseminated the problem was. And she was given the last act of kindness. She was a very sweet girl. B25162 is a 7-year-old stallion. He thinks he is hot stuff. He is a brown and white paint. He is one of the few horses on the whole load that we got that is a totally appropriate body condition score. So he's a 4 out of 9. He's right where we want him to be. He did have a fever on intake, and he is pouring copious amounts of bright yellow banana pudding snot. I've had a bunch of people be like, thanks a lot. I can never eat banana pudding again. It's the best descriptor I have. My wonderful pathology professor used food analogies all the time, and they're kind of my favorite. But his lungs did sound okay. So this is another, going back to that last mare. This horse is, pouring, like dripping out onto your arms as you're working with him. This is one of the reasons why we wear PPE when we take them in, and yet his lungs sounded okay. He had very slightly enlarged lymph nodes. He has evidence of fighting all over his entire body, but he's a stallion. They like to fight. He had very overgrown hooves. He definitely had 2 testicles present. And we ran a CBC on him that confirmed for sure infection, also anemia. So he needs to be gelded, but we want to make sure he has no fever and that his CBC is more normal before we schedule him for castration. We collected a sample of his snot to send it off. I didn't start him on antibiotics, and the reason for that is we like to use evidence-based care, and in his case, he's bright, alert, responsive, active, pouring snot. He's over by himself, so he's not posing an infectious disease risk to others. I don't want to risk starting him on an antibiotic only to find out that he has a multi-drug resistant infection, and I just made things worse by giving an antibiotic. So our wonderful lab is really quick. We should have those results by next week, and we can start him on an antibiotic then. B25-163. I cried 3 times before 10 a.m. this morning, so hopefully our media team edits that out so I seem like a normal professional. This horse really got me. He was a 29-year-old quarter horse gelding, body condition score of 1 out of 9. You could see basically every bone in his body. You could see the vertebrae in his neck from both sides. Absolutely unacceptable. He also had a heart murmur, point of maximum intensity over the mitral valve. As horses age, your heart valves don't close quite as crisply. His was only like a 2, so it wasn't severe. Dr. Alex also got to listen to that one. That by itself was not a major concern. He did have pain on palpation of his spine. He had really bad sunburn on his nose. But we took radiographs of his mouth, and he had, I wrote on the paper, most severe hook wave mouth I have ever seen. Hands down. I have seen some of the most horrific dental pathology in horses probably most practitioners see, because we see the worst of the worst here at Horse Plus. This horse's teeth were jagged, sharp bits of fractures. The ones in the front were poking into the gums in the front, and the ones in the back were poking into the gums in the top. So his occlusal surfaces should have been like this, and they went like this, and he had just open wounds front and back of his mouth. Absolutely unacceptable. That kind of dental pathology is truly preventable with just annual veterinary exams and care. This was the sweetest, most compliant horse. I really lost it and soapboxed for a minute. Horses just really don't, they give us so much more forgiveness than we deserve. I mean, this gelding came right up and he was just the sweetest boy the whole time. I gave him so many cookies that we couldn't take his dental radiographs because he just kept chewing. So he got a lot of cookies. B25-164. This mare was only 12 years old. She was a branded standard bred. Her registered name was Feel Appeal. She was a bay. And yesterday we did a brief visual exam. Didn't put her into our top category for immediate triage, but today I actually fed them breakfast this morning. I got here early and I looked at everybody. So I fed her this morning. She was quiet, alert, and responsive this morning. But we were working on another horse, heard a crash, and she fell acutely onto her back with her legs in the air and just went rigid. And And while on the ground, so our team literally saw that happen. I mean, we were out there maybe 20 seconds after she fell. She was in a pen with other horses, but all of them were kind of hanging back. So we don't suspect that there was any altercation. It didn't appear that she had slipped and fallen. She just acutely fell onto her back, which is very abnormal for a horse. And once on the ground, she was rigid and unresponsive with her tongue out the side of her mouth. So horses, they can slip, they can fall, they can choose to roll because of discomfort. But for a horse to lose control of their mouth to the extent that their tongue is just hanging out, it's very, very abnormal. Her mucous membranes were pale to white right away. And so I checked her capillary refill time. It was 4 seconds initially, which was about twice as long as we want it to be. But a few minutes later, it was absent and her mucous membranes were completely white, like white as a piece of paper. She made no attempts to move. So she went down. She actually didn't hit her head because she went down with her neck on a post, and I ended up with her head kind of on my lap and legs, and she was just rigid and made no attempt to move. So if you're watching this and you go, why didn't you try to pick her up? There's no picking up an animal that's not participating. This mare was completely unresponsive. I gave her Banamine intravenously, which is a nonsteroidal anti-inflammatory medication. She had no response to that. So I gave her some xylazine intravenously. Xylazine is an alpha-2 sedative, but it also has really good analgesic properties. So my goal was to increase the pain control and also provide some relaxation in the form of sedation. She also really didn't have a lot of response to that. So you probably want to know what happened, and I do too. I actually don't know with this mare, but what I suspect, my hypothesis, is that she had an acute cardiac event, because when she first fell, her heart rate was only 16, which is extremely slow. So that's bradycardia. Then it went up to about 44, which is a little elevated, but for a horse that just fell flat on her back, I would expect that heart rate to be 90. You know, that's acute stress. Horses are prey animals. You don't want to lay on your back. So her heart rate went back up to kind of just a little bit over normal, but then it was widely variable. So her heart rate was super irregular, and she rapidly developed a third heart sound that wasn't present initially. So my best guess is that she suffered an acute cardiac event. She could have had an aortic aneurysm. She could have had any other underlying cardiac disease. She could have had a heart attack. Horses can experience cardiac arrest. But she progressively moved to look like she was passing. So I think if our team had done nothing, she would have been deceased within maybe the next 10 or 20 minutes. I intervened and humanely euthanized her. But devastatingly sad, this mare was only 12 years old. I don't know what happened to her that culminated in this really shocking cardiac event. And unfortunately, normally you would want to do a necropsy. Our team is swamped. I've got 12 more horses I have to intake this week that we haven't gotten to. And so we discussed as a team and we elected not to perform a necropsy on her, even though we all wanted answers, because we have so many other critical horses that are still living who really need our care. B25-165, I have in all caps, needs very little drugs. I gave this mare like the teeny tiniest little bit of a sedate because she was worked up and she was very groggy. She's a 19-year-old quarter horse. She's quite thin. She's a BCS of 3 out of 9. She's a bay with a little star. She's very friendly and easy to catch. She was bright, alert, and responsive. Heart rate and respiratory rate were within normal limits. Her heart and lungs sounded normal. Her lymph nodes were normal. She had some decreased gastrointestinal sounds, but she also was a little bit dehydrated, but she was drinking really well. She had a lot of overgrowth on her feet, and she had this weird shoe only on her left hind foot that's dragging around. Our farrier is coming tomorrow, and she's on our priority farrier list. But otherwise, we took radiographs of her back because she had a lot of scarring, and she had kind of disseminated back arthritis. So she had a lot of very small osteoarthritic lesions. There wasn't any major, oh my goodness, she has kissing spine, she has something here or there. But because she had some mild discomfort on palpation, I labeled her as a pasture pet. She's very sweet. I think she would make a great pasture companion. So she needs ASAP farrier care, but she will be turned out to decompress after that. And hopefully she will make it to adoption. Oh, this pony also made me cry. B25166 was a 28-year-old pony gelding, also body condition score of 1 out of 9. This pony had a severe heart murmur and fecal water syndrome, which is not an actual diagnosis, it's a description of having poop that is beyond diarrhea. It's just straight water that just shoots out. And this poor guy was missing all of the hair on his back legs because he'd been defecating this way for so long. Sorry. But he was so respectful. So Elizabeth was taking pictures of him, and he got really kind of like antsy. And it's because he tried to move away from her because he had to defecate. So he was really aware. My two big parameters are comfort and dignity. And these old ones that just lose their dignity, they really break my heart. He had a lot of eye problems. He had bilateral cataracts. And he had a lot of edema on his face and some really severe dental pain. But mostly his hind end was so uncomfortable. We can treat diarrhea. Fecal water syndrome is treatable. There's a lot of things that you can try to do. But in a really old boy with no teeth and severe cardiac disease, it didn't feel fair to ask him to keep going. And he was given the last act of kindness. The ones that still love on you, when you look at their bodies and you're like, I do not deserve your love and affection, and you're giving it to me anyway. B25167 is a 15-year-old standard-bred gelding. He is so gorgeous, you guys. This gelding is just knock your socks off beautiful. He's very thin. His brand is 6HM94, and his registered name is Drylander, which I think is kind of a terrible horse name. We don't keep their registered names usually. We keep names if we have owner surrenders because often they know their names. But this gelding was bright, alert, and responsive, easy to catch, halter trained, normal heart rate, respiratory rate, heart, lungs, lymph nodes. He does have diarrhea, but he has normal diarrhea that's somewhat kind of cow patty formed. So we'll check him for parasites. He got dewormed today. Usually with diarrhea cases, as long as they're doing well otherwise, we kind of diagnose as of exclusion them, and deworming is something we do with all of these guys anyway. He is blind just in his left eye, and he will likely need that eye removed before adoption, but it's not currently painful. It just is moving towards that entropion that I described earlier, which is the lids rolling in. He did have big scarring over his withers and his lumbar spine. And when we took radiographs, he does have several kissing spine lesions, some up in his thoracic spine and some in his thoracolumbar area. However, notably, so kissing spine just means the vertebrae of the back that are supposed to be parallel to each other and not touching are touching in some manner or another. Kissing spine is tough because sometimes it's atrociously painful and sometimes it's totally non-painful and they can live with it all of their lives. And this horse, when I palpated his back, he had a lot of back pain that's associated with a superficial wound in his skin, but he didn't have pain on palpation where the x-rays showed the worst spots of kissing spine. So I want to save everything I can. So, and his resting heart rate was normal. So he is on our ASCP farrier list for tomorrow. We put him down as a pasture pet only. So we're not going to ask him to carry a rider, but he seems comfortable enough that I think he can have a good quality of life being a horse. B25168, oh my goodness, was a 23-year-old Belgian mare. Gorgeous, gorgeous mare. She also had diarrhea. She had very, very painful feet, mostly her front feet. All 4 of her feet seemed uncomfortable, but she had severe lateral overgrowth, so bad that her legs were rotated in and her front knees touched because her hooves were that overgrown. She was very painful. I picked her feet. She had horrible mucopurulent discharge from both frogs. So we can treat abscesses. An abscess is not a big deal. But I took radiographs of the left front, which is the worst one, and she had a gas tract all the way up to P2. So when you look at a horse's leg, P1 is the kind of the long pastern, P2 is the short pastern, P3 is the coffin bone, which is the one actually in the hoof. And a gas tract that goes all the way to the coffin bone by itself is catastrophic. This gas tract went all the way up to the top of the coffin bone and communicated with the joint above that. And the bone was all moth-eaten and lytic, which indicates a bone infection. So this poor mare had an actively infected and resorbing bone. So we can treat a hoof abscess. We cannot effectively treat a severe infection of the bone in a horse's coffin joint or bone. She was given great pain medication. She wasn't actually able to pick her foot up without pain medication. And when we gave her pain medication, she could pick her other foot up for just a minute so we could look at it. But she was given the last act of kindness. B25-169 is a 16-year-old standard-bred gelding. He is a really unique color. He's a dun standard-bred, which I didn't even know standard-breds really came in dun color. His registered name is, it's either Stony Soprano or Story Soprano. He was severely lame on his left hind leg with a lot of effusion in that suspensory. But when we looked closely, he had an abscess in that leg that Dr. Alex opened and it actively drained. And I will not say that his lameness improved significantly. His lameness improved a little bit. So that gives us hope that an abscess is very treatable. He is on my treatment list immediately after this video. We're going to go up and soak that foot and put an animal Intex pad on it and try to drain that abscess further. And then he is also on our ASC farrier list for tomorrow. Other than being extremely thin, having really, really bad rain rot and a lot of scars and really small superficial wounds, we did not find any other major medical concerns with him. And he's a super good boy. So I am hopeful that we can get him comfortable into adoption. B25-170 was an at least 27-year-old Hackney pony gelding. I love Hackneys. They're the Chihuahuas of the horse world. They have no idea that they're tiny. They're very saucy. This little gelding was so friendly and cute. Very thin. I body condition scored him at 2 out of 9. He also had a pronounced heart murmur. So we graded his murmur at 4 to 5 out of 6. He had decreased gastrointestinal sounds in all 4 quadrants. So his GI tract was moving, but it wasn't moving normally. He had pretty severe rain rot. His teeth in the front were worn to the level of the gums. He had a lot of discharge from both eyes. His back was painful on palpation. And when we took dental radiographs, all of his teeth had diastema, and his premolars 1 and 2 on both sides were fractured. So diastema just means there's a space between the teeth where there shouldn't be a space. And if you just have one tooth affected, sometimes you can pull that tooth, but all of his teeth were affected. And he also had a severe hook wave mouth. So that means instead of going like this, it went like this. His were not as severe as the other geldings because he didn't have ulcerated puncture wounds from his teeth. But there was nothing that I could have done to correct them because he had so little teeth left that I essentially would have, we could have tried to pull all of his teeth. But for a very older boy with cardiac disease, it didn't feel fair to ask him to undergo a lot of dental procedures, and he was given the last act of kindness. The last horse we looked at was B25-171. She was a 2-year-old quarter horse filly. Super sweet. Actually, would she be a mare as a 2-year-old? I'm not good at that stuff, you guys. If you're watching this, I'm not sure whether we called her a mare or a filly at that point, but she had all of her baby teeth. She was bright, alert, and responsive. She was very, very nervous. And I described her as sweet, but evidence of trauma. So she really wanted to be curious and come over, but as soon as you touched her or did something with her, you could tell that it wasn't a neutral response. She had not had someone care for her. She also had liquid diarrhea with scald on her medial hind legs. Hers was much less severe than that older gelding. Her resting heart rate was 52, which is elevated. Her left face was so swollen that it looked like her eye had sunken in, but it was just that her face was that swollen, and she had a puncture wound that was draining a little bit on that side. Her left front leg, in her pastern right here, she also had kind of like a snare-like wound that went all the way around the front. So we obviously gave her pain medication. We took radiographs, and similar to the other horse with the big granulation tissue that had bony proliferation, she had severe periosteal reactivity and proliferation on the affected bone P1, but it extended to both upper and lower joints. So it wasn't just that she had really reactive bone, it was that she had multiple joint spaces affected. So every step that she took and movement that she made, she had bone touching bone. But then she also had bony lysis that was consistent with osteomyelitis. So I wrote secondary to encircling wound, infection went into the bone. This is also heartbreaking because if this little filly had had appropriate medical care right when she got her wound, she probably would have been fine. I can't say that 100% because I wasn't there, but based on what it looks like, usually what happens is you have a skin wound. If you can close it, great. If you can't close it, you can usually kind of close it and bandage it. But this filly got an infection in her skin that tracked deeper in, and then she got an infection in her bone, and her bone was so reactive that at this point, you couldn't even surgically fuse the joints because it's multiple joints, and she wouldn't be able to bend her leg at all. So sad to get them this young and with a wound that you look at and go, if only I had had this 5 months ago, I might have been able to save this case. And she was given the last act of kindness. And that was our last horse. This is a really heavy, hard job. So if you're watching this and thinking, what is happening? I'm really proud of Horse Plus. I've worked with them for close to 10 years, I think 9 years. A big part of what we try to do is education. Tanya and Jason do a lot of lobbying. I think people in this country would do better if they knew what actually happened to older horses. And a lot of what we try to do at this organization is message. We offer free euthanasia grants. If you have an older horse and you're worried about quality of life and you can't afford a veterinarian to come euthanize your horse, please call Horse Plus. We offer grants in other states. We believe in ending suffering, and we really want to message how important it is to have a relationship with a veterinarian and to have your animal see a vet at least once a year so that they can have the care that they need. They're prey animals. They hide pain really well. They hide discomfort really well. There's so many things that you can do to keep a horse healthy and happy into their late 30s, early 40s. I mean, horses really can live long, happy lives if they're cared for appropriately. So hopefully you learned something today, and thank you for watching.